How are you?
I'm good.
My name is Courtney Banks, and I'm a family nurse practitioner student at the George Washington University, and I'll be conducting your examination today. Your name is Miss Dancy, correct?
Yes.
Is it okay if I address you as Miss Dancy?
Yes.
Okay, I'm going to go ahead and wash my hands before I begin this examination, okay? Thank you. Okay, right now, Miss Dancy, I'm just looking at your overall appearance. You look great, well nourished, no tremors at rest. Your demeanor is good. So right now, I'm just going to go ahead and assess your scalp, looking for any indentations, any nevi, and it's good, it's fine. You have equal hair distribution throughout your head. I'm going to go ahead and lift your head up. I'm going to move your hair out your face. I'm going to feel your sinuses. Everything is midline. Your mouth is midline, nose, eyes equal. Okay. I'm going to begin the assessment with your eyes. I'm just feeling for any indentations around your eyes. And it's not. Okay. Have you been noticing any problems seeing or anything at all? No, not at all. Okay. So right now I'm just shining this light into your eyes. I need you to open your eyes up and focus on the back of the worm, okay? Good. Perfect. And I'm looking at your conjunctiva. Your lower and upper eyelids are pink and they look good. Okay, great. Okay, Miss Nancy, what I'm going to have you do right now is just to follow my hands with your eyes, okay? Okay. And now what I want you to do is to point from your nose to my finger, and we're going to alternate hands. We're going to do the right and the left hand. You can choose whichever one you want to go first. Good job. Okay, good job. Just fixing your gown. It was falling down a little bit. Okay, so for this portion of the examination, I'm going to go ahead and dim the lights. I'm going to just shine a bright light directly into your eyes, okay? So I'm going to ask you to focus on the back of the room, and I'm going to keep your eyes open, and I'm going to open it as well, okay? So right now I'm looking for the red reflex. I'm shining the light on a 15-degree angle. Open your eyes, please. Thank you. Open your eye for me. Good. So have you been having any trouble with your hearing at all? No issues with hearing? You hear me fine?
Yes.
Okay. So next part of this examination, I'm going to go ahead and take a look at your ears. Right now I'm just looking at the external structure. Looking for any deformities or anything for the external structure, okay? Can you scooch to the edge for me, please? Tympanic membrane looks great. Thank you. And I'm going to look at the external structure over here as well. Tympanic membrane looks good. Excuse me. Okay. I'm going to whisper some numbers in this ear. I want you to repeat them, okay?
1, 2, 3. 1, 2, 3.
Okay, perfect. For this portion of the examination, I'm going to go ahead and put on my gloves, and I'm going to assess your mouth. Have you been having any trouble with your taste or your teeth or anything? Okay, perfect. So right now I'm just looking at the external mouth for any lesions or any dryness, and it looks fine. You can go ahead and open wide. Okay, so I'm just palpating the gums, feels good. Looking at the dentition, it looks great. Go ahead and say ah for me.
Ah.
Making sure the uvula is midline, looking at the soft and the hard plates. Your mouth looks great. Okay, Miss Nancy, can you go ahead and smile for me? Good. Can you lick your tongue out and stick it from the left to the right? Good. Can you make a sad face? Okay. Can you go ahead and scrunch your eyes up? Try to stop me from opening them. Good job. Can you go ahead and make a puff face? Good. Good. So right now, I'm just feeling. Go ahead and also I want to feel your mastoid process. Try to clench down like you were like, Okay. Good job. And right now you can just relax your face. And right now I'm just feeling for your sinuses, okay? I'm going to put your head to the back. And I'm just feeling for your sinuses. Your lymph nodes, sorry. Periocular lymph nodes. Down to your mandible. Lymph nodes with the pads of my fingers. You can relax your head down. Feeling for your occipital lymph nodes. You have no enlarged lymph nodes. Everything feels great. Now I'm just making sure that your trachea is midline in the middle, just placed in it. And I'm going to come around behind you and I'm going to ask you to swallow for me, okay? Go ahead and swallow. Good job. Okay. So now I want to feel your pulses, your temporal lobe. Good. I'm going to take a listen. Good. And I'm going to feel on this side, your temporal lobe. Good. And now I want to assess your carotid pulses one at a time. Go ahead and look forward for me. Hold your breath, please. Perfect. You can breathe. Hold your breath, please. Sounds great. Okay, so now I'm going to go ahead and begin your respiratory exam. If at any time you feel any discomfort, because I'll be asking you to breathe in and out a lot, just let me know, okay?
Okay.
I'm going to have to raise this shirt up, okay?
Okay.
So right now I'm just feeling the back of your back.
Mm-hmm.
Do you feel any pain at all?
Mm-mm.
No pain whatsoever?
Mm-mm.
Okay. So I'm going to go ahead and percuss in a ladder-like motion. You'll feel a tapping on your back.
Mm-hmm.
If you feel any discomfort, just let me know. Are you able to hold maybe? No, you're fine. Okay, you're fine. Okay, Ms. Nancy, go ahead and take a deep breath in for me and hold it. Okay, go ahead and exhale and breathe in and hold the exhalation. Okay, perfect. You can go ahead and relax. So now I'm going to ask you to take a deep breath in and out. Good. And now what I want you to do is to repeat the numbers 99 over and over again, okay?
Mm-hmm. 99, 99, 99, 99.
Okay, perfect. And now at this portion of the exam, I'm going to go ahead and listen, okay?
Mm-hmm.
Deep breath in, please. Out. Now what I'm going to ask you to do is to whisper the numbers 1, 2, 3. And now at this point, what I'm going to ask you to do is to repeat the letter E, E, E every time you feel me move the stethoscope.
E, 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 E.
Good. So I'm going to go ahead and pull your shirt down. And I'm going to come around to the front and assess also your lungs. And I'm going to move your head to the back, okay?
Mm-hmm.
Go ahead and take a deep breath in. Out. Lift your arm up for me. In. Okay. 99.
99, 99, 99, 99.
E.
E, 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 E.
1, 2, 3. Whispering.
2, 3. 1, 2, 3. 1, 2, 3.
Whisper. Oh. So next, I'm going to go ahead and examine your heart and your peripheral vascular system. Right now, I'm just feeling over your heart. And I'm going to go ahead and take a listen. Sounds great. Good. S1 and S2. I'm going to lift your breast up and I'm going to listen to you. Perfect. Sounds great. Good. So now at this point in the examination, I'm looking at your extremities. I want to make sure that there's equal hair distribution throughout your extremities, which it is, and it's warm. I want to make sure it's no nevi. I want to make sure you have good capillary refill. Checking your radial pulses. And I'm going to do that bilaterally as well. Making sure it's good hair distribution, equal warmth throughout, good capillary refill, radial pulse, and it's good. What I'm going to ask you to do is to bend this arm for me. Good. Right now I'm just feeling left nodes. No enlarged lymph nodes. Same thing here. Lymph nodes. No enlarged lymph nodes. You can go ahead and relax. And I'm going to come down here, look at your legs, assess for any swelling, any pitting edema, make sure it's equal hair distribution, which it is. Feeling for pulses here. And I want to come up here, feel for the popliteal lymph nodes, and also for the popliteal pulse. And I also want to assess capillary refill, which is good. Come here, good hair distribution. Warmth is good. Assess for the pulse. Pulse is here. Come up, popliteal lymph nodes, no enlarged lymph nodes. Good popliteal pulse. Okay, so what I want you to do, right now I'm just going to assess your like extremity strength. What I want you to do is to press, like, do exactly what I'm doing with your fingers. Yeah, good. Good job. Good. And now what I want you to do is very quickly. Good job. You can stop. And it's one portion of the eye test that I want to do again right now. What I want you to do is to focus straight on me. Follow this finger in. Follow this finger in. Good job. And when you begin to see my hands, I want you to let me know. You see it in both sides?
Yes.
Okay. Okay. So I want to identify this. This is soft touch. And I want to know if you feel it equally on each side of your face, okay? Equal?
Yes. Yes.
Equal?
Yes.
Equal?
Yes.
Feel it the same?
Yes.
You can relax a little.
Yes. Yes.
So now this is a hard touch. You feel it?
Yes.
Hard touch. Feel it?
Yes. Yes. Yes.
And I'm gonna take this. You feel it?
Yes. Yes.
Well, I have this too. This is a hearing conduction test. Basically, I'm gonna put this instrument on your head,
Mm-hmm.
and what I want you to do is I want to make sure there's no lateralization.
Okay.
So I didn't do this, right?
No, you did
Okay.
not.
I want to make sure it's no lateralization. So I'm gonna put it on your head, and if you hear it more in one ear versus the other one, just let me know. Okay.
Okay.
It's equal.
Mm-hmm.
Good. So now we're gonna go. I'm gonna check your bone conduction in comparison to your air conduction. Okay. Start. Let me know when you no longer feel it, or hear the vibration.
I no longer hear it. I hear it. I no longer hear it. I hear it.
Okay. So now what I want to do is I'm just assessing your fingers or your joints,
Mm-hmm.
making sure there's no enlarged joints, which is not. No enlarged joints. So what I want you to do is to open your hand up wide. Try to stop me. I want you to close it. Close it like this. Now try to open it. Good. What I want you to do is to flex up, flex down, flex to the right, flex to the left. Good. So you have good wrist and hand motion. Now I want to come to the elbow. I want you to flex the elbow up.
Mm-hmm.
I want you to stop me from breaking it. I want you to flex it down. And I want you to hold your arm out like this. Try to stop me from pressing down. Good job. You can relax. Now I want to come here.
Mm-hmm.
I want you to hold the arm all the way up.
Mm-hmm.
I want you to hold it here.
Mm-hmm.
Try to stop me. And I want you to go ahead and relax it. Now I want you to come over and try to touch your scapula. Good job. Any pain?
Mm-mm.
And I want you to come behind and try to touch it. Behind. Perfect. We're going to do the same things over here, okay? Good job. So I'm looking at your joints. Your joints look great. No enlarged joints. I want you to hold your hand out. Try to stop me from closing it. I want you to close it and try to open it. Good. I want you to flex your wrist up, flex it down. To the right, to the left. Good. So now I'm going to come here to your elbow. Flex your elbow up. Just try to stop me from breaking it. Good. Good job. Flex it down. Good job. Now we're going to come out all the way up. Midline. Try to stop me. Down. So you want to go back over. Good. You're going to come on and back. Good. Now I want to do something called a cross body test. Tell me if you feel any pain. Good. Cross body test. Good. Now what I want you to do is to squeeze my hands, pull me in, push me away. Awesome. So now at this point in the examination, I'm going to assess your spine, your gait, your walk, and you can go ahead and stand up for me. Okay. So right now I'm looking at your spine. You can go ahead and tilt your head forward. Looking at your cervical spine, your thoracic spine, your bony prominences. Nothing is protruding. Everything is equal spaces, equally aligned. Coming down to your thoracic spine, lumbar. Go ahead and lean forward for me. Good. And then stand up for me. Lean to the right. Lean to this side. Good. I'm going to come in front of you. I'm going to ask you to shrug your shoulders and try to stop me from pushing down. Shrug your shoulders and press against my hand. Press against my hand. Good. Now I just want to observe you walk to that chair and back. And now on your way back, I want you to walk with one foot in front of the other. Okay, great. You can go ahead and have a seat. Good. for this portion of the exam, you can go ahead and lay back. I'm going to go ahead and examine your abdomen. I'm going to keep you covered during this portion of the examination, okay? Okay, so go ahead and flex your neck up for me. I want to make sure there's no protruding around the umbilicus or anywhere within the stomach. Before I touch, you can relax. Before I touch your stomach, I always want to listen first for the bowel sounds. I want to listen with the bell of my stethoscope for the aorta. I want to listen to the renal and the iliac arteries. And I want to come down here and feel for the femoral. Listen to the feel and listen to the femoral arteries. Feel and listen to the femoral arteries. Okay, good. I want to palpate the bladder. Make sure it's not enlarged, which is not. I'm going to go ahead and begin a light percussion motion in all 4 quadrants. And then you'll feel a light palpation motion. If anytime you feel any discomfort, just let me know. Right now, I'm just trying to see if I feel any abnormalities or enlarged processes or anything. Everything feels good. I'm pressing light with the balls of my fingers. Everything feels good. I'm going to go a little bit deeper now. Everything feels good. So now I want to assess. Now I want to come here, feel your rib cage. I want to assess for your liver. Right now I'm just going to do a light percussion motion. Okay. Go ahead and take a deep breath in for me. Perfect. Relax. Breathe out. Good. Now I want to come on the other side. And I want to feel for your spleen. I'm going to go mid-axillary. Okay. And I want to be sure that I listen over your liver and your spleen. Okay. Now I'm just looking at your legs. I want you to flex. I'm going to take these socks off. Flex this ankle towards the ceiling. Press against me. Press up towards the ceiling. Press up and then press down like a gas pedal. Press up towards the ceiling. Press down like a gas pedal. Good job. I'm going to keep you covered. And I want to assess the knee. Can you go ahead and bend your knee up towards you? Good. Flex it down. Bring this leg out. Any pain? Bring this knee up. Flex it towards you. Flex it down. Bring this leg out. Any pain? Okay. So I'm going to bring the leg over the opposite direction. Press against me. Good. I'm going to bring the leg over in the opposite direction. Press against me. Okay. Now just general motion. Bring this leg all the way up. Try to stop me from pressing it down. Bring this leg all the way up. Try to stop me from pressing it down. Good job. Ms. Nancy, you can go ahead and sit on the side of the examination table so I can assess your reflexes, please. Thank you. Okay. Relax this arm for me, please. Relax your legs for me. And also, what I need you to do, Ms. Nancy, is close your eyes for a minute. Take a deep breath in. Do you recognize this smell?
Mm-hmm.
What is it?
Alcohol.
Good. Deep breath in. Do you recognize this?
Yes.
What is it?
Alcohol.
Okay. Now, last but not least, I want to come over here and you're going to feel me I want to just let me know if you feel any tenderness, okay?
Mm-hmm.
No?
No. No.
Good. Okay. Alrighty, well, I want to say thank you for allowing me to do this examination. And if I have any recommendations for you, I'll give them to you at the end of the exam. Thank you and have a good day.
Thank you.